We are Onco.com. We are the world's first patient-centric cancer management platform. We connect you with the right experts, with treatment centers, and with accredited diagnostic centers. Today, we are talking in particular about nutrition, and we have with us Dr. Krishna Priya. Thank you for joining us, Dr. Krishna Priya.
Thank you, Shruti.
Thank you. Dr. Krishna Priya is Onco.com's dietitian, senior dietitian. And if you would like to know more about our services, you can give us a call on 79965 79965. We also have our app, which is Onco Cancer Care app, which is free to download on your phones. So today we are talking to Dr. Krishna Priya about those cancer patients who are also suffering from diabetes. So as you will appreciate, diabetes already brings with it certain dietary restrictions, and to also manage a rigorous cancer treatment alongside can be challenging, particularly if you do not have access to the right information in terms of nutrition and diet. So to just get started, Dr. Krishna Priya, if you could explain to us a little bit about what diabetes is and what are the types of foods that diabetes patients are generally supposed to avoid.
In simple terms, I'll explain what diabetes is. Okay, so it is just a group of diseases that result in too much of sugar in the blood. So some of you might have heard about different types of diabetes like type 1, type 2, pre-diabetes, gestational diabetes and all. So out of these, type 2 diabetes is the most common among adults. So in simple terms, I'll just explain how blood sugar level is raised during diabetes. So some of you may be aware that glucose is the main source of energy for body cells. So most of the food we eat is converted into glucose and our body uses it for energy. Then the pancreas in our body releases a hormone called insulin, which helps move this glucose from your blood into the cells. So when you have type 2 diabetes, your body does not use insulin like how it should. So as a result, what happens is too much of glucose stays in your blood, and this condition is usually called as high blood sugar. Uncontrolled diabetes actually can cause many serious consequences like heart disease, kidney disease, and many other complications. So people with diabetes are at higher risk for developing cancer, especially cancers of pancreas, colon, lung, and prostate. So coming to the second part of the question, like what kind of foods need to be avoided by the cancer patients? Actually, carbohydrate, proteins, and fat are the macronutrients that provide energy to the body that everyone knows. So among them, carbohydrates have the greatest effect on blood sugar. So this is because carbohydrates are broken down into glucose and absorbed in our bloodstream. So carbohydrates, actually there are three types of carbohydrates like starches, sugar, and fiber. Out of this, sugary and starchy carbohydrate raise blood sugar level. That means that will increase blood sugar level. But fiber is not digested but absorbed in the body same way like other carbohydrate like sugary as well as starchy carbohydrate. So fiber does not raise your blood sugar levels. So when people with diabetes consume too much of carbohydrates at a time, especially sugary and starchy carbohydrates at a time, their blood sugar level can raise to a higher level, dangerously higher level it can raise. So maintaining actually a low to moderate carbohydrate diet can prevent blood sugar spikes and reduce the risk of diabetes complications. Then for those with the diabetes, actually sugary beverages, then aerated beverages, etc. will increase blood sugar levels. Along with that carbohydrate rich thing, trans fat which is found in fried fast foods, then bakery products like crackers, muffins, then processed and packaged food are also not healthy for diabetic cancer patients. Not only for diabetic cancer patients, it's not healthy for normal human beings as well. So although trans fat actually do not directly raise the blood sugar, they have been linked to increase the insulin resistance. So it can cause insulin resistance. So insulin can't act properly if the diet is rich in trans fat. So along with starchy, sugary carbohydrates, even trans fat also has to be restricted. So it's best to avoid any product that contain the term partially hydrogenated in the ingredient list. If it's not mentioned as trans fat, sometimes it can be mentioned as partially hydrogenated. That food also has to be avoided. Then along with that, then packed snacks made from refined flour, that's maida, refined flour, also can quickly raise blood sugar levels. Therefore, these are the foods that has to be avoided by a diabetic patient. But one more thing is like living with diabetes does not mean that you have to feel deprived. They should learn to balance their meals by making healthful food choices, by including foods that they enjoy in a better way. But people with diabetes can choose to include these food in correct proportion. So no need to avoid it completely. If it is chosen in correct proportion, sometimes occasionally they can go for it, but not on regular basis. So these are the main things like sugary, starchy beverages, trans fat has to be avoided as much as possible in the diet.
Understood, Dr. Krishna Priya. So in that case, for a diabetes patient who is also undergoing cancer treatment, what would you say is the perfect diet for them?
Actually, for diabetes and cancer, it's actually two entire things. Like many literature shows that like around 8 to 18% of cancer patients have diabetes. And for many diabetic patients, once cancer is detected, diabetes management takes a backseat. Actually, they will prefer mainly for cancer, and diabetes take a second place. But managing their blood sugar levels is as important as cancer treatment to improve their overall health. So cancer treatments actually like radiation therapy, then some steroids, some types of chemotherapy also may impact their blood sugar levels, not only food. So uncontrolled high blood sugar can lead to dehydration, which is a frequent side effect of chemotherapy as well. So taking extra care to manage blood sugar levels can help them stay hydrated and feel much more better during the treatment time. So, a diabetic cancer patient's diet should focus on a healthy eating plan that's rich in proteins, vegetables, then whole grains, and cereals which are low in fat and calories. So, it's very important to keep the blood sugar level also well under control in a safe range during the cancer treatment. So, in general, what I can say is for people who have diabetes and cancer, the key is to maintain a beneficial diet to include proteins, again, vegetables and fruit, whole grains, then choose food which are less in added sugar and avoid trans fat as much as possible.
Understood, Dr. Krishna Priya. So you had also mentioned about the role of fiber. So when we say fiber, we generally refer to high fiber foods and low fiber foods. So which ones do you think are preferable for cancer patients with diabetes?
Dietary fiber, it's also known as like roughage or bulk. It's also termed as like roughage or bulk. So dietary fiber, it's classified into actually two types. One is soluble and the other one is insoluble. So the name itself suggests that soluble is soluble in water and insoluble is not soluble in water. So soluble fiber is found in foods like oats, then peas, apple, then beans, citrus fruits, carrot, broccoli, avocado, and so on. So soluble fiber actually dissolves in water, as I already told, to form a gel-like material, and it will help to lower the blood glucose level. But insoluble fiber, it promotes the movement of food through the digestive system and increase the stool bulk. So it can be of benefit for those who are struggling with constipation. Examples for insoluble fiber are whole wheat flour, then wheat bran, nuts, then vegetables, cauliflower, potato. These are all good sources of insoluble fiber. So as I already mentioned in the previous question, like unlike other food components, fiber is not digested by the body. Instead, it passes through the stomach, small intestine, colon, and it's then excreted out of the body. So a high fiber diet, especially of soluble fiber, may have important benefits for people with diabetes, particularly I told soluble fiber like oats, beans, apples and all, that it can slow the absorption of sugar and help improve the blood sugar levels. So total dietary fiber intake for a diabetic patient, it should not exceed for more than 20, it should be in the range of 25 to 30 grams per day. But when it comes to diabetic cancer patient, there are some instances when fiber-rich food may actually aggravate your stomach. So if it is something like they are having side effects like loose motion or stomach cancer and all, no, too much of fiber can't be included in their diet. So at these times, a modified fiber diet can help depending on the type of cancer, symptoms like diarrhea, constipation, and so on. Fiber has to be modified. So in general case, diabetic patients can have like around 25 to 30 gram. But in case of diabetic cancer patient, based on the side effects and cancer, type of cancer, we have to modify the fiber.
Understood, Dr. Krishna. So basically, a high fiber diet is generally considered good. So you said foods like oats, apples, beans, etc. are good, except in cases where you either have a specific type of cancer like stomach cancer, or you are having certain side effects, symptoms like diarrhea, etc. In those cases, this will have to be modified.
Yes.
Got it. Perfect. And a lot of caregivers constantly are looking out for information on what types of foods are good to give their cancer patients. Recently, a lifestyle blog spoke about the goodness of having eggs with the yolk, which is the yellow part. So egg with yolk is supposed to be good for diabetes patients who are going through cancer treatment. So if you could verify this information and explain it a bit for us.
Okay, so before answering this question, I'll just introduce a term called glycemic index. So actually glycemic index, it's a value assigned to foods based on how slowly or how quickly those food can increase the blood sugar levels. So different food have different glycemic index. Okay, so low glycemic index foods have glycemic index score. That score will range from 0 to 100. So low glycemic index food have a score below 55. So they contain carbohydrates that take the body longer time to break down and than the low, high or medium glycemic foods. So low glycemic index foods raise a person's blood sugar levels more slowly than moderate or high glycemic foods, as I have already told. So egg is considered as a low carbohydrate food and which have a very low glycemic index score as well. That means glycemic index score is below 55. So this makes them a good source of protein for people with cancer as well as diabetes. So cancer patient, as you already know, that they need good quality of protein, and that too, egg is a good source of protein. So egg is considered as a lower glycemic index score food. So egg are rich in other nutrients and it's very low in calories also. So it's actually a complete protein. That means it has all 9 amino acids that our body cannot produce itself and can be only obtained from the diet. So egg is a complete protein diet food. So they also contain other nutrients like choline, potassium, which are good for hair, especially during cancer treatment. Hair loss will be there. So egg contains choline and potassium, which are good for memory, hair, mood, and as well as insulin production. Also, it will help. But one more thing is egg has cholesterol. Eggs are high in cholesterol also. So if you have diabetes, actually you should limit egg consumption to thrice a week and egg whites on a daily basis as per the individual requirements. So egg yolk, it contains fat. Because of the fat content, it has to be restricted to thrice a week, and egg white can be taken on a daily basis without any issues.
Understood, doctor. And coming to milk and milk products, what we call dairy products. So how safe is it for patients with diabetes and cancer to consume these things, milk, curd, ghee, butter? How safe is it?
Including milk and milk products, that means dairy products, as a part of well-balanced diet can be beneficial in managing diabetes. So milk contains carbohydrates and is important for people with diabetes to consider this into their carbohydrate count, because milk has carbohydrate, so it has to be counted in the carbohydrate count. It is not always recommended to have milk at bedtime for diabetes because of the carbohydrate level in that. So the higher the amount of calories in milk at night can be dangerous. So it has to be avoided during bedtime based on their individual timings, food timings and all. So the best dairy choices, milk product choices when you have diabetes and cancer is yogurt, curd, buttermilk, and so on. And milk can be taken whenever they are active. So like especially in morning time, milk can be introduced. So to sum up, what I can say is that dairy products can be incorporated in the daily diet of diabetes and cancer patient based on the, again, type of cancer, their sugar levels, their activity level, age, and so on.
Understood, doctor. Another area of diet which leads to some confusion is fruits. So diabetes patients are not allowed to have certain types of fruits. Then cancer patients, also certain foods are good for them, certain fruits are avoided by them depending on what treatment process they are going through. So if you have diabetes and cancer together, what sort of fruits can be safely consumed?
Again, here the glycemic index term we have to apply. Like eating fruit, it's a delicious way actually to satisfy the hunger, to meet the daily nutritional needs, especially for a cancer patient. But however, most fruits contain sugar. So GI, I told you, glycemic index plays a significant role in selecting which fruit has to be taken by a diabetic and a cancer patient. So some fruits have a less GI, like less GI means the score will be below 55, like apple, avocados, cherry, grapes, kiwi fruit, then orange, plums, and moderately ripe bananas, not overripe, moderately ripe bananas. These all have low glycemic index that they can incorporate these fruits in their daily diet based on their sugar levels. Okay, so a fruit with a GI between 56 and 69 is considered to be a medium glycemic index food. Examples for medium glycemic food, glycemic index fruits are like papaya, pineapples, and all. And fruits which have higher score, like more than 70, are considered as high glycemic index fruit. And example is like a watermelon. So, like while fruits are safe with people with diabetes and cancer, it is important to eat larger quantities of lower GI food. That means like apple, avocado, berries, and all lower GI food that can be taken in larger quantities. And fruits with higher and moderate GI has to be taken in a lesser quantity based on their sugar levels. So for say if lower GI food can be taken in good quantity, means it has to be based on their sugar levels. If sugar is about 200, 350 and all, again even low GI fruits also has to be avoided on that particular days.
Understood, doctor. So moving on to some queries from patients who are non-vegetarians. So if we consider lean meats, like people tend to consume chicken or fish, is it safe for them to continue having these kind of lean meats during cancer treatment if they also have diabetes?
Yes. Actually, lean meat and meat alternatives are the best options for people with diabetes and cancer because it is less in saturated and trans fat, and it's a good quality protein also is there in lean meats. People with diabetes should choose lean meats to limit their intake of unhealthful fats. So better trans fat and saturated fat has to be avoided. Just stick on to lean meat source of proteins. So these include like chicken without skin, turkey, then fish, some seafoods on a daily basis they can take as a, to meet up their protein requirements. But they should eat only a smaller portion of medium fat meats like minced meat like ground beef or pork, lamb. These are medium fat meats. It has to be taken on a medium level, and that too not frequently. So the lean meat can be taken on a daily basis. If they don't have any other issues with non-veg, it can be taken on a daily basis. But people with diabetes should avoid like high fat and processed meat. So they have to completely avoid high fat and processed meat such as sausage, hot dogs and all. But medium fat can be taken as per the sugar levels, as per their likings, and as per the cancer type also. Medium can be incorporated because they have iron as well, like especially liver, heart, then pork and all have good source of iron as well, so it can be incorporated based on cancer types and all. The amount of meat that people should eat each day actually varies according to individual factors that I have already said, like age, body size, their activity level and all. So it is suggested for any diabetic patient to switch better to a white meat like poultry, seafoods, chicken, fish, and avoid red meat as much as possible. And if required, only has to be taken in very moderate level. And the quantity of lean meat varies from person to person based on their body weight, nutritional requirement, and cancer type and so on.
Understood, doctor. Now, a lot of diabetes patients, they are told not to keep themselves hungry, to manage their sugar levels with the frequency of their meals. So for diabetic patients who are on cancer treatment, what should be the frequency? So what is the minimum or maximum time gap that should be given between meals?
So those who are suffering with diabetes and cancer might have heard about small frequent meals. You have to take small frequent meals. So the term they might be familiar. So if you have diabetes, you need to eat about main thing is eat same quantity, almost same quantity, same amount, same timings daily. Try to stick on to same timings as much as possible to avoid hypoglycemia and all. And they should not skip meals or go for more than 5 hours without eating anything during the day. So it should not, the gap should not be more than 5 hours without eating anything throughout during the day, because it can affect and end up in hypoglycemia, low blood sugar level. So eat small amount of food 4 to 6 times a day instead of eating 2 or 3 big meals. It helps keep blood sugar levels from going too high after a big meal. So just keep, like already mentioned, like small frequent meals means 4 to 6 times a day they can have it. And a 3 to 5 hour gap between your meals is proven to be very effective actually to control blood sugar level, and it's ideal for cancer as well. So they can't eat at a time too much of quantity. So it's the time gap 3 hour can be maintained so that their appetite also will not get affected much, and it will not end up in weight loss during cancer treatment. Along with that, sugar levels also can be kept under control. So actually our digestive system, it will take around 3 to 5 hours to digest a food completely. So the ideal gap I have already mentioned, it should not go beyond 5 hours. That long gap should not go beyond 5 hours. Approximately 3 hour gap they can maintain. And in general, for most people with diabetes and cancer, meal timings, it should space like equally throughout the day. Means they have to start their breakfast within 1.5 hours after getting up. Don't delay the breakfast. Have your breakfast within 1.5 hours after getting up, and then have like every 2.5 to 3 hourly gap. Have healthy snacks in between, then go for main meals, again healthy snacks. Like that, they can maintain the timing so that it should not go beyond 6 meals a day.
Understood, doctor. So smaller meals 4 to 6 times a day, and ideally a gap of 3 hours between meals, but definitely not exceeding 5 hours gap between meals.
Yes.
Understood. Now, moving on to consumption of tea and coffee. So a lot of us are in the habit of frequently taking tea and coffee throughout the day. So for cancer patients with diabetes, how is this? Is it okay to do this or not?
Okay. Tea and coffee actually contains a compound called caffeine that has a capability to lower the insulin sensitivity. So if you have like a type 2 diabetes, their body already does not use insulin as well as a normal individual. So there will be some insulin resistance, insulin sensitivity and all. So after meals, their blood sugar level rises higher than the normal range. So caffeine, if caffeine is taken in food, caffeine may have make it a little more tougher to bring it down to a healthy point. If the diet is having too much of caffeine, it makes it a little more tougher to make the blood sugar level into a healthier range. So this may lead to high blood sugar levels throughout the day. For some people with diabetes, about 200, but there is a safe limit, like around 200 milligrams of caffeine per day is okay. It's considered safe, but that means around 200 milligrams of caffeine means around 240 milliliter, 240 ml of a brewed coffee or a plain coffee. That much of a cup of coffee has 200 milligrams of caffeine. So that has to be avoided. So have to limit the quantity to 240 ml. And many people like to sweeten their tea with sugar or honey or jaggery to enhance the flavor by choosing unsweetened tea, by choosing other things. And so actually unsweetened things can be taken, but even if it is jaggery or sugar, it has the same effect of using the normal sugar. So better avoid sugar, whichever having carbs, no, as much as possible in the diet. And unsweetened tea or coffee within this limit, around 240 ml per day, is safe. And if you have diabetes or you're struggling to control your blood sugar levels, actually limit the amount of caffeine in the diet, what I have mentioned, around 240 ml per day. And better in coffee, go for decaffeinated coffee. That is best option for people with diabetes than a caffeinated coffee. Decaffeinated coffee can be taken because it has lesser amount of caffeine in that.
Perfect. So basically 240 ml if it is unsweetened tea or coffee, and preferably if it is coffee, decaffeinated is a better option. But you're saying using sugar or even honey or jaggery is all to be avoided with the beverages. Understood. Now, there are some types of diets, especially for cancer patients, they are advising them to reduce their carbohydrate intake in the diet. So, for cancer patients who also have diabetes, does this sort of diet work where they are restricting the amount of carbs that they are consuming?
Actually, there is no evidence that cutting carbohydrates completely from the diet of cancer patient or diabetic patient will help treat cancer or diabetes better. So completely carbohydrates no need to be cut down from their diet, but there are some dietary guidelines. So recommended allowances are there for carbohydrate intake. That is like dietary guidelines recommend that around 45 to 60% of daily calories can be from carbohydrates, even though if they have diabetes. Okay, so sometimes cancer treatment like chemotherapy may cause nausea and vomiting, which may affect their food intake and result in low blood sugar levels. So it's very important to take anti-nausea medications as prescribed to avoid hypoglycemic attacks and all. So you will feel much better during cancer treatment if they are able to eat and drink at regular intervals. So when they are feeling well, they can continue with a healthy diabetes meal plan. And sometimes in people with diabetes and cancer, blood sugar levels rise due to reasons other than food they eat. So increased blood sugar can be a response to stress on the body, as well as the result of medications such as steroids and all. So continue to eat a balanced and drink plenty of water if the blood sugar levels remains high for no apparent reasons like steroids or stress and all. So for that time, food has to be given in small frequent meals, as I have already mentioned, to make it better under control. And for those with the diabetes, it is important actually to monitor the total amount of carbohydrates in a meal. So carbohydrate needs will vary actually based on the many factors like person's activity level, medication, age, then their mode of works and their lifestyles and all. So actually it has to be modified. Total carbohydrate count has to be monitored to maintain a healthy blood sugar level range.
Understood, doctor. So basically, you're saying a balanced diet with plenty of water, and balanced diet will include carbohydrates also. Got it. Now, a lot of cancer patients, while they are going through cancer treatment, sometimes they have cravings for things. You know, it could be sweet things, it could be junk food, ice creams, or something fried. So, what would you suggest? How do you manage these cravings if you also have diabetes?
Mm. Junk foods, as you all know, it's an unhelpful food. So they are usually high in calories, fat, then again sugar, salt, processed carbohydrates are there, and it's very low in useful nutrients such as fiber, vitamins, minerals, and so on. So junk foods includes many types of fast food, then processed food, then pre-made snack food, and all. So these cravings can be controlled actually by different ways. So first thing is drink a glass of water or some flavored water like jeera water or methi water or cinnamon water whenever they have cravings for junk foods, because sometimes dehydration also can cause cravings. So it can't be normal usual craving. Sometimes dehydration, because of dehydration they will get that craving. So first thing is drink a cup of water. If better, go for if not feeling better, they can try something like a flavored water that I've already mentioned, like jeera or methi, cinnamon, and all. Then second one is they can have a fruit at that time to control the craving, especially they'll be having craving for sweets. So then have a fruit at that time based on the previous meal intake. So if they have already taken food before main meals before 2 hours, then they can go for a fruit at that time. Then next one is choose a salad or a vegetable based meal whenever possible to control the cravings. So salads and vegetable which have fiber which will help to control the craving. So include salads and vegetable based meals which whenever possible. And next one is avoid artificial sweeteners, because that also can create that craving sensation. So avoid artificial sweeteners as much as possible in diabetic patients diet. And then eat more protein, that they should feel that appetite is under control and all. Otherwise they will feel that frequent, if diabetes is not under control, they'll feel more frequent appetite and all. So if protein is there in the diet, that appetite can be controlled. And then other things are like have to sleep well, then avoid excess stress, then have to control the portion size of each food and all. And main thing is it's important to realize that craving is not the same as hunger. Okay. So it's not your body that is calling for energy. It's actually the brain calling for something that releases a lot of dopamine in the reward system. So something like a dark chocolate can be like a very small quantity, like around 5 grams of dark chocolate, which have more of cocoa, like more than 70 percentage cocoa content things can be taken occasionally to control that excess cravings.
Understood, doctor. Thank you. And you said about taking a balanced diet. So that brings us to the question of fats in the diet. What sources of fat would you recommend for cancer patients with diabetes?
There are actually 4 types of fats. One is saturated fatty acid, polyunsaturated fatty acid, monounsaturated fatty acid, and trans fat. 4 types of fats are there. So out of this, first one is saturated fat that are found in meat, dairy products, and some oils like coconut oil, palm oil, and all, which are not good for overall health. So eating too much of this saturated fat will raise the bad cholesterol level in the body. That means LDL level in the body. So a high fat food, high fat meats also have saturated fat, like hot dogs. Again, I told in previous question, like hot dogs, sausages, high fat dairy products such as full fat cheese, then cream, ice cream, whole milk, butter. These all have saturated fats that will increase the bad cholesterol level. So this saturated fat has to be avoided as much as possible in the diet. But coming to the second one, like monounsaturated fatty acids, they are considered as a part of healthy balanced diet because of the protective effect they have on heart. So these fats have been shown to lower the bad cholesterol. The saturated fat will increase the bad cholesterol. Monounsaturated fat will will help to lower the bad cholesterol. So this means monounsaturated fatty acids include like avocado oil, canola oil, nuts like almonds, cashew nuts, peanuts, then olive oil, peanut butter, sunflower oil, and so on, safflower oil, and so on. So, but one more thing is be sure to be mindful of the portion size that they are eating. Like all fats, no, it has calories quantity. Even though it will lower the bad cholesterol, quantity has to be maintained. So same thing is PUFA, similar to monounsaturated fatty acid. Polyunsaturated fatty acid also lower the bad cholesterol. Actually, omega-3 and omega-6 fatty acids are the two types of polyunsaturated fatty acids. So actually the sources of omega-3 fatty acids are like fishes like salmon, sardine, mackerel, tuna and all. And other foods are like walnut, flaxseed oils and all, good sources of PUFA, means polyunsaturated fatty acid. And sources of omega-6 food are like walnut, again flaxseed, egg and all, good source of omega-6 fatty acid. Coming to the last fat, it is called as trans fat. We have already mentioned this term in previous questions and all. So I'll just tell what is trans fat. So trans fat are produced when a liquid oil is made into a solid fat by a process called as hydrogenation. So it is more harmful than the saturated fat. So already we have told like saturated fat is not healthy for a daily intake. So this trans fat is little more harmful than this saturated fat. So these fats are seen in actually store like bakery foods like cookies, then crackers, French fries and all. Then it will raise the bad cholesterol. Again, LDL level will be high if you take more of trans fat. And first thing is you have to check food labels and avoid foods that are mentioned as trans fat is present. That food has to be avoided whenever you choose a store cookie or something. So overall, I'll say like 20 to 30 percentage of total calorie, it should come from fat, because our body needs fat to absorb fat soluble vitamins. So no need to avoid fat completely for diabetic and cancer patient. They can use they can have from their diet 20 to 35 percentage. So that means they can take daily around 15 grams of fat each day, visible fat. 15 grams means it will come around 1 tablespoon. Okay, 3 teaspoons or 1 tablespoon of fat they can use on a daily basis. That is visible fat. Along with that, other foods have invisible fat as well. So altogether, it will meet up to 20 to 35 percentage of the total calories. So eating actually too much of fat can lead to taking in more calories than the body needs, which may affect blood sugar level control, and overall health will end up in excess weight gain and all. So main thing is replace a saturated fat with a healthy fat. So saturated fat, I have already told, like coconut oil, palm oil, and all those stuff, butter and all. It has to be replaced with some healthy fat like polyunsaturated or monounsaturated fatty acids, which will help to lower the blood sugar levels, will help to improve the good cholesterol level, and will help to improve the insulin control as well.
Understood, doctor. And previously you had also mentioned about portion control when you were talking about meat. So how important is portion control in terms of quantity of intake? How much food the patient is eating? If they have diabetes and cancer, should they restrict the portion size?
Portion control is important because it allows them to have a tight control on how much calories, total calories they are consuming. So portion size is defined as the amount of food that someone puts into his or her plate for a single sitting or a single meal. So portion control involves like eating a healthy assortment of different food groups. So how much they eat at every meal is the key in helping you to manage type 2 diabetes. So each person's needs are actually different. So the number of portions one need is based on their weight, again gender, activity level and so on. So I'll just tell you how to take exact portion for a meal. So how exactly a diabetic cancer patient's plate should look like. So that plate at each meal should be filled with some non-starchy vegetables and smaller portions of starchy foods and lean meat. So when you take a plate, first thing is try to draw an imaginary line down the center of your plate, and then on one side of your plate divide it again into two halves. So half of the plate, it has to be filled with some non-starchy vegetables like cucumber, cauliflower, beans, ash gourd, bitter gourd, and so on. And 1/4 of the plate has to be filled with lean meat like fish or chicken or some other vegetable source proteins like pulses. And 1/4 of the other 1/4 of the plate again can be filled with some starchy food or some non-starchy cereals, so like chapati or rice or bread or potato and so on. So this way, if you are balancing the plate, the portion size will be able to control, and always try to have food in like a small or a moderate range plate, not in a big plate.
That was very interesting, Dr. Krishna Priya. So basically, to divide the plate into half, and the first half has non-starchy vegetables, like you said, cucumbers, cauliflower, etc. Then the other half of the plate you again divide into two, and one portion of that is lean meats or vegetarian sources of protein like pulses, and the other remaining portion only will be starchy foods like rice or chapati, which we tend to eat more of generally. So understood, got it. Now moving to a customized diet plan. So a lot of times in your answer you have said it depends on, age of the patient, weight of the patient, so many other things. So I want to understand this, how important is it to customize your diet plan to the person, or can we follow a generalized diet which is available off the internet, for example?
Okay. So from the above questions, you might have able to understand like customized diet is very important. Even if it is a type of cancer also, based on type of cancer, it will vary. And based on the sugar levels, that type of diet will vary, means portion control will vary. And age, gender, everything matters. So when they eat, what they eat is really important. That's main thing. When they have cancer and diabetes, eating is very important to control their blood sugar levels and to maintain the body weight and all. So their body needs actually enough calories and nutrients to stay strong during cancer treatment and diabetes management. But cancer and its treatment side effects can make it very hard to get what they need sometimes. And sometimes they just won't feel like eating at all. They will be simply avoiding, which can end up in hypoglycemic effects also. So first thing is, keep in mind that every person with diabetes and cancer should have a customized meal plan that provides more freedom in terms of their food choices. So whatever I said, no, based on their food choice, we have to customize their diet plan. Then only it will be easy for them to follow. Then second one is the diet plays a very crucial role in managing diabetes by controlling the type and amount of blood sugar and carbohydrates going into the body. So there also a customized diet plan have a very significant role. And generally speaking, what I can say is there are some basic diet recommendations that in portion size I have so told. No, it's like a basic thing. So generally speaking, there are some basic diet recommendation that are healthy for individuals with diabetes and cancer. But it has to be customized. So to get better result, it has to be customized based on, again, symptoms of cancer, food preferences, blood sugar control, age, and so on. So not one single diet plan would suit for all. Better go for a customized diet plan so that it will be easy for them to follow, because even their food choices also will be taken under consideration when diet plan is being prepared.
Understood, Dr. Krishna. Now we've also got some questions from our viewers. One of them is talking about dry fruits. So is it safe for diabetic cancer patients to consume dry fruits?
Dried fruits, it have more concentration of sugar and contain more than 4 times as much of carbohydrates as fresh fruits have. Okay, so for example, I'll say like 1 cup of grapes, it has nearly around 27 grams of carbohydrate, whereas 1 cup of dried grapes, that is raisins, contains around 115 gram of carbohydrate. That much of difference are there in fresh fruit and a dried fruit. But if eaten in moderation, dry fruits may not be that bad for blood sugar levels. So this can be included in a daily meal plan as a fruit alternative. That means if normal fruit is not taken, that time it can be replaced with a dry fruit. And diabetic cancer patients actually should select dry fruits which have lower glycemic index. Here also glycemic index have a good value because it has to be chosen based on the glycemic index, dry fruit. So when I have informed about the fruit, there also it has to be chosen based on the glycemic index. Even dry fruit has to be chosen based on the glycemic index. So dry fruits like dried apple, dried apricot, then prunes, then dried plums, dried peaches, everything, they are lower glycemic index food than fig, raisins, and dates. So whichever fruit like apple, dried apricot, prune, and all are having low glycemic index. And fig is having a medium glycemic index, and dates and raisins, dry fruits like dates and raisins have high glycemic index. So a diabetic cancer patient actually can eat dry fruit, but not in excess quantity. And better you can just replace it. Some days if they want to eat a dry fruit, you can better replace it and have a dry fruit. Avoid a fruit and have a dry fruit with that quantity. Always it is better to have a fresh fruit because of the fiber content, because of the low carbohydrate content and all. Because I have already told that this is having more of carbohydrate, nearly 4 times. So quantity has to be taken into consideration while having dry fruit.
Understood, doctor. The other query is also about protein powders. So when these are given as supplements for cancer patients, protein powders, is it okay for diabetic patients also to consume it, or does it impair sugar control in any way?
Protein powders, if they are taking a normal diet with the adequate calorie, carbohydrate, proteins and all, then there is no need of taking a protein supplement. But if their food intake is affected, again, they are not able to eat well, protein supplements can be used as a meal replacement in sometimes. And even food intake is moderate, protein powders can be considered as taking as a in-between snack. Okay, so there is no harm in taking protein powders. Again, it will depend upon the diabetes. During diabetes, chances are having like kidney issues and all will be there. So it will again depend upon the creatinine, urea values and all. Protein powder has to be customized based on their blood parameters, renal parameters.
Understood, doctor. And someone has asked us a question about frozen foods. Can a diabetic cancer patient consume frozen foods?
Frozen food will be considered as a trans fat, which have trans fat. So I have already mentioned like this has to be avoided. Try to have it as a fresh fruit or fresh vegetable as much as possible.
Understood, doctor. Now there is a question about sweeteners. So can you suggest some sweetener options for diabetic patients? Would you recommend sweeteners?
Actually, it's better because I told you know in cravings, sweetener is one of the reasons for having that cravings. So it's better to avoid sweetener as much as possible, or in case if needed, something like low calorie sweeteners or 0 calorie sweeteners can be used. So many products are available in market now. So any one can be chosen, and the quantity is very important. Very small quantity only has to be taken if required. Otherwise, there is no use of taking a sweetener because there is nothing. There is only taste matters. So after that, no, there is nothing like any nutrient is there in sweetener. Even any nutrient is there in sugar as well. So better avoid that as much as possible in a diet.
Doctor. And the last question we have is, I'm not sure if you're able to give in general, but they're asking restricted foods for CML patients. Is there any general or is it personal?
There is no food to be restricted for CML patient, but again, if their neutrophil count or platelet count, WBC counts are low, that time they have to have a low microbial diet. That means don't take fruits and all as a raw thing, just steam it or have it, or just make a juice when it after steaming the fruit and have it, because there are more chances of getting infections, fever and all with a normal diet. So if their blood parameters are all fine, they can go with a normal diet on.
Perfect. Thank you so much for these answers, Dr. Krishna Priya. Thank you for giving us your time today. This was very helpful.
Thank you, Stuti. Thank you.
And for for our viewers, if you still have any questions, you can leave it in the comment section. We will get the answer from Dr. Krishna Priya and make sure it reaches you. Or you can just give us a call on 79965 with any other cancer-related queries you have. Thank you for joining us for today's session. Thank you all. Thank you, Dr.